Meet Matthew, a young man in his 20s who initially felt like he didn't need any life and health insurance. Being young and single, he didn't see it as a priority. However, when he was scrolling on social media, he came across a post from a life and health insurance advisor that really hit home to him. So he decided to reach out, and with the expert's guidance, he took out income protection, critical illness cover and private medical insurance. Now, Matthew soon realised the importance of the insurance he had taken out when his mum very suddenly passed away from cancer, which took a serious toll on his mental health. So here's how his life and health insurance became a crucial source of support for him. So Matthew's mental health decline left him being unable to work, though thankfully his income protection policy kicked in, paying him a monthly benefit. So he didn't lose out on his income during this time. Instead, he received money each month, meaning he still had the funds to cover his rent, bills and other essential expenses. Through the cover Matthew had, he was also able to access some free services which his advisor made him aware of. He made use of a free counselling service which supported Matthew to better mental health through talking therapy sessions with a bereavement specialist, and he also had access to a video GP service which allowed him to receive support remotely when needed, and he also made use of a free annual health MOT service which is designed to detect the possibility of future health conditions. Now, Matthew sadly discovered that he carries the same cancer gene as his mum, so knowing this and his increased risk, he's really glad that he took out the life and health cover that could protect him in future. So if Matthew did develop cancer, he could use his private medical insurance to skip the NHS waiting list and access treatment much sooner. This was something especially important to him, as with his mum, the NHS cancer targets were missed. Private health insurance would also give Matthew access to specialist drugs and treatments that aren't necessarily available through the NHS, meaning he would have a better chance at recovery. Thanks to the critical illness cover Matthew took out, he could receive a lump sum payment if he was diagnosed with cancer, and this would help him cover all the extra costs he might face if he was seriously unwell, such as travelling to appointments and parking costs. As income protection doesn't end after a claim, it is also there for him to potentially claim on again in future during the policy term. So if you'd like to learn more about how these different products can protect you and your family, then visit our Knowledge Centre or see our other resources. If you're ready to get a quote, then use the buttons to do so or book in a call. You can also reach out to us through our contact page.